Welcome to the HEROES training. So just real quickly, those papers are good for 4 CEUs. So I encourage y'all to fill that out, pre-test, post-test, and the eval. They will be going to the administrator so that you can get your CEU certification. So we're going to talk about the tactics for treating the responders, the first responders in military that we get. It is a different population. None of this is by any means, any ways of excusing any behaviors, making excuses, or dismissing any of the maladaptive or unruly behaviors that we see. It is just a way to explain their thought process and kind of what we're seeing on the unit. So, as I'm sure we're aware, the HEROES track is a 2-tiered program. We have Tier 1, Tier 2. And we'll get into the difference between the two in a minute. With the HEROES program, you've got the groups, Monday, Wednesday, and Friday. And you have the individual therapy sessions, anywhere from 1 to 3 times per week. And that's with both myself and Dr. Todd, whether they're doing talk therapy, EMDR therapy, or both. What's been happening lately is they'll do an EMDR session. If it's really intense and there's a significant amount of trauma that comes up, they do 2 EMDR therapy sessions and then process in a 3rd session with Dr. Todd. EMDR is really intense. So you're going to see an increase in intensity in their behaviors after an EMDR session, because a lot of the trauma comes up. The irritability is expected. The tiredness, the lack of control over the emotions that are coming up is very present. So you're going to see that happen. We do take different types of therapeutic approaches, both in the group setting and in the individual therapy setting. Whether that is trauma-focused CBT, trauma-focused DBT, we've got psychodynamic that happens in there, trauma-focused guided meditation. So the group settings are very trauma-focused. And that's why it's really important that we assess them prior to them coming into group, because we have to know that they're emotionally stable, mentally stable, and that they are physically capable of doing so, because we also do some somatic exercises. So they have to be assessed prior to that. What's also offered in the HEROES program that does eventually get interpreted is some diagnostic testing. It's self-administered diagnostic testing. It helps us know where their strengths are, where their struggles are, their weaknesses are, some of their cognitive deficits are. So for some of them, we implement the diagnostic testing, then it gets interpreted. So it's a 2-tier system. Tier 1, and just a little bit of a background. So as many of you know, I served in the U.S. Army for several years, come from a very military family background. So I understand where they're coming from with that thought process, and have experienced actually a lot of the same traumas they have, and have gone through a lot of my own self-discovery and work to get to a point where I can function. Tier 1 is the responder, the first responder with active duty military, or the veteran. They gotta be, again, mentally and emotionally stable. It's a fast-paced, trauma-focused group. The ability to handle type A personalities. So sometimes their sense of humor, their sarcasm, their demands are very type A, very upfront, very in your face. What appears to be maliciously confrontational, but it's not. So the cohesion in the group has to be present in order for it to work. So the personalities, the type A, they all have to be able to relate to that. And the ability to engage and get graphic. So a lot of times they're sharing their trauma stories. They're talking about really horrific traumas. They go into detail. And so one of the questions I ask them before as we're determining tier 1 or tier 2 is, are they easily offended? If they are, they will be referred to tier 2. Because in the group setting, I don't filter them. However they're going to process and tell their story and process their trauma, I don't stop them. And a lot of times it gets really, really graphic. And they talk about the guts, and they talk about the smells, and they talk about what they see in detail, because that's how they're processing. There's even a lot of curse words, and I don't stop them. I do let them know that this is a safe group, and this is the only group where they can do that. So they pick up on that. So far they've done well, I believe. So tier 2 is also, again, it can be the responder, it can be the military personnel, it can be the vet, if they are not ready to process the trauma. If they are not motivated or forthcoming, then they will be in tier 2. Again, because tier 1 is so fast-paced. It's also the family member of the responder or military. Because as the family members, we experience different things that those that are not associated with families of those careers may not completely understand. Those associated with government work or contract work, not stable condition, again, mentally, emotionally, physically. They gotta be stable, otherwise they will be in tier 2. In tier 2, they do get the written and behavioral assignments. They do get the individual therapy sessions. They just don't get the group setting. In the different personality styles, if the cohesion is not happening in the group, they gotta be referred to tier 2, because that will stop the therapeutic process of the group. So we look at the different occupations that come through here to be considered for the HEROES program. We've got the military, the police or law enforcement, the firefighters, and so forth. Here's the deal with a lot of that, with the military and the paramilitary. Paramilitary, of course, being the law enforcement, the firefighters. The training is very in your face and very intense, and the primary part of the training is you kill or get killed. And that is so instilled in them on a 24-hour basis. Instilled to the point where they are yelled at 24 hours to get that in their head, kill or be killed. So that training amends our thought process and changes it to a point where this has now become regular. This is the norm. This is how I have to think to survive. So it's a little bit different from other occupations that may experience trauma. So in this particular group, we focus on that. We look at that thought process. I understand that thought process. It's the kill or be killed. And that becomes their way of thinking on a day-to-day basis. That's what we see when they come in. And we'll get into that a little bit more. The dispatchers of the emergency personnel, they get that, as well as some of the others that are listed on there. They get all of that thought process. They are working in that trauma and in that way of thinking on a day-to-day basis. So they understand that. Including, there's one on there that looks a little bit iffy, but including the tow truck drivers who are frontline first responders. How many have we had that were first responders on the scene of a DUI accident, let's say? So a lot of assessment goes into this, a lot of thought process goes into tier 1 or tier 2, or even acceptance into the HEROES program.
Everybody in the room pretty much knows me. I don't know if you two know who I am. I'm Dr. Todd Langus. I'm one of the therapists here that come in and treat the responders, and I was also in law enforcement for 23 years. Some of the stories you'll hear from me today of what I went through in working as that part of the population. One of the first things is how to understand how responders view their job. As Christina said, it's ingrained all the time in them, the training. It's so ingrained in them that the job isn't just what they do like most professions, it becomes who they are. It's a part of them. And you guys may know this. You go to a party, you may have heard this, where somebody says, "Hi, I'm an accountant." Nobody goes up and says, "Hey, can you do my taxes right now?" Or "Oh, tell me about your job." But if somebody says, "I'm a police officer," "Oh, you ever shot anybody?" Or "I got a ticket, can you," and they're asking things, or firefighters, or military. So even the outside influences puts that pressure on them to make it to where it becomes their job. Now, how it gets interpreted is, if my job, anything that gets said negative about the profession, you're speaking about me. So you might even be speaking about another responder, and they will jump to their defense, because not just speaking about them, no, you're talking about my profession. You're talking about me too. So that will come up at times. And also, even though the camera's here, folks, please interrupt if you guys have questions. This training is for you guys. So please, please, please. It's okay. He can cut and edit, and we're all good. The other problem with this translation is this is what leads to disillusionment for them. And I'll explain a little bit more later. If that's who you are, look at what's going on right now. How do you think law enforcement is feeling? They are in complete disillusionment. You know what? If you don't want me to help, we're done. I'm not going to do anything. They're going into a disillusionment, and things are going to get way worse before they get better if, law enforcement and society doesn't start working together and getting a better relationship. This is what causes that overinvestment, the demands of the job. They're working 12-hour shifts, 24-hour shifts. They're working overtime. It's not 8 hours, punch out, go home. Plus the overtime that they have to work, mandatory. The 24/7 expectations of the job. Think about it. What other profession is out there where you're carrying a piece of equipment with you at all times? Can anybody think of one?
Ben's got a cell phone.
All the time. Yeah?
24 hours a day. But yeah.
But there's really, and people bring up, well, a doctor. I've never seen a doctor carry a doctor bag into a restaurant. But usually a responder has equipment on them at all times, safety equipment. I feel naked if I'm out there without a gun. It's been part of me for 23 years. I feel vulnerable without it. Don't worry, I don't carry one in here. So 24/7 expectation, getting called in for emergencies and whatever's going on. The media. Judgment, 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 judgment. That's all it is, and it's not positive. If you see them out there helping, well, they used excessive force, let's say. And then if they don't help, well, where were they? So it's a no-win situation. It's the media creates things. Look over in Iraq and Afghanistan and some of the wars, the way they've portrayed soldiers. Plays on them.
There's many, if you notice, a lot of our military will come in and sometimes deny their involvement in the military or what they've experienced. They minimize. And I don't know if you remember, but even when I first started here, I denied being in the military. And when I was asked, do you have any military service? No. We want to detach, especially when we've experienced so much trauma, we want to detach as far away as we can. And we want to minimize our involvement in any of that, because if we talk about it and admit it, then it's so real. It becomes real again. And sometimes that trauma, regardless of how long ago it was, is still very much alive today in our minds. So even to admit it and to say, yes, this is what I do, this is what I've experienced, there's feelings of guilt, there's feelings of shame, and it just stays. And it lives in there because it becomes a part of who we are and not just what we do.
That's why the biggest proponent that is the biggest help is intake. Because they'll talk to you guys They'll be real with you guys before they come through these doors. And it's not that they don't want to be real with us. Who's around listening? I try to talk to responders. I get them isolated. They're more apt to talk that way and give you information than out in a crowd.
A lot don't even know what a first responder is. We're talking on the phone.
Yes.
What's a first responder?
Yes. Yes. Or some people will say, you'll say first responder, and a nurse won't say, they won't, or a doctor won't connect the dots. No, I'm not a first responder. I'm not out there on the front lines. When we say responder, it's anybody in the field where your front line is taking care of people. Therapists can be responders. We get affected. We get traumatized. Vicarious trauma. So, and the other thing too is why they don't want to admit it is judgment. I'm going to be judged. Responders are trained to think different than civilians. Okay? Civilians are trained to think in probability. We are probability thinkers as civilians. And I'll give an example of that. If we were all to take a trip, well, I'm going to Vegas, leaving Friday, so we're going to go to Vegas. I'm going to get there early. My wife can meet me there. So if we were going to fly to Vegas, what airport would we probably fly out of? If we're leaving from here? Ontario Airport. Why? Because it's probably the closest airport. What airline would we probably fly? Southwest. Why? It's probably got the best fares, probably has the most flights. They probably won't charge us for baggage or oxygen we have to breathe. That's probability thinking. Responders don't think that way. They're trained to think in possibility thinking. No, we forget there's a lag time from the time our brain is thinking one thing to have to shift to a second. That split-second lag time is the time that all responders are injured or killed. So when they come through our doors, they're in possibility thinking. Everything is possibility. They're in, not well, I'm probably going to be sober. They're in possibility, and it's negative. I'm not going to be able to do this. So that's what we're getting when we see them. Now, we have to shift them out of that. When you see them in that possibility thing, now they're not going to tell you, I'm in possibility thinking. How you're going to pick it out is it's going to be negative. Or you're going to see irritability. If you see irritability, they may be in possibility thinking here. They're thinking the worst, thinking the worst, thinking the worst, thinking the worst. Because here's how it goes, and they're trained this way. If I prepare for the worst, all worst case scenarios, and the worst happens, I survive. I'm ready for it. If I prepare for worst case scenario and it doesn't happen, no harm, no foul, everything's good. That is true, and it works very, very well on the job. It does not work in their personal lives. That's the problem. So we have to shift them out of this. They're thinking negative about their program. They're thinking negative that we're going to be able to help them.
So
Okay.
I'm going to jump in real quick on this one, because here's what is happening in the groups. Okay, we have those that are vets, those that are active duty. Active duty, I cannot strip these away from them. The vets, I want to, but the active duty, I can't, because they're going back into this. They need this. They need this to survive. This is what's helping them be top-notch in their career, and it's helping them be successful. So I can't strip that away from them. So what we're focusing on at this point is how to transition from when you're at work to when you're at home, and how to see the difference. This is working great with my command and with my platoon. It's not working well with my kids and my wife or my spouse. So now the primary focus in the group setting, along with the trauma work, is relating some of these traits and bringing it to the forefront, helping them identify it and helping them transition and see where is this working and where is this not. But I would be doing them we'd be doing them a disservice if we just stripped it from them altogether. So they are not we're looking at it like, this is great, here's the validation, because this is working for you in this area of your life. It's not working so much in this area. So that's super important, just to stay mindful of that we're not stripping this from them because they need it. And it's helpful, it's survival skills.
If you ever, I'll point it out to you guys, Christina and I still are in possibility thinking a lot of times. If you ever notice us out taking a break, we never stand together. We stand facing opposite directions. Why? She's got my back, I got her back. Possibility. Even in Flash, if she's sitting here, I may sit at another angle so I know she's got that door and those windows and I got this door.
And this is the type of stuff that just happens. We don't think about it. It just happens. This is what we're talking about when it's a part of who they are. Even if they come in and they've been out of the service or off the field for 20 years, it's still such a part of who they are. And it's not conscious. It just happens. And it just happens. I have to watch your back because I'm constantly in that possibility thinking. And it takes a lot to be like, okay, I'm in possibility thinking. I mean, it doesn't happen.
And that's just like dealing with patients. We should all be vigilant to the fact where you never put the patient in between you and the door. Ever. Nursing, ever. Make sure that you are always at where you can get out. Now, you guys came up with these traits and behaviors that you guys had to learn to do the job well. So do responders. And some of the things may be different wording, but you're going to see a lot of the same ones. Okay? One that they have is an all or nothing thinking. Win or lose. We either win or we lose. Everybody comes home and we win. If somebody doesn't come home, we lose. That's a loss. Everything is win or lose. Which also is another one you'll see here pretty quick, is called black or white thinking. Give me the facts, give me the facts. It's one or the other. There is no gray area. When they come into treatment, we're asking them to go into gray areas. We're asking them to shift out of possibility and think into gray areas. Could there be another reason for things? And they have a difficult time doing it, and you'll see frustration in them, or they'll shut down. They have to be all things to all people all the time. So do you guys in here. You weren't here, you're not just their counselor. Sometimes you're their mother, their father, their sister, their brother, the shrink, the medic, all these things. You guys brought up detachment. You have to detach to get the job done. So do they. They see ugly things, so they detach from it. And that's where a lot of times you'll see the negative black humor that most people would go, oh my goodness. Helps them detach. Always have to be right. They always have to be right because their credibility is relying on it. They have to be right to their admin, why they did what they did. They have to be right to the press to justify what they did. So in here, they're going to fight you on that. Have an answer for every problem. It's how their job gets done. They have to have an answer. I got to come up with a solution. It's solution-based. They expect that from you guys, don't they? It's one you guys have to have. Always maintain control. You guys brought that up in a different way. I can't lose it out there. So you always have to maintain that control. Rapid decision making. Believe it or not, we have to do that in here, don't we? Especially, I don't know about you guys. You're doing a group with somebody. I don't know. I've had this plenty of times when I'm doing therapy with somebody. I'm sitting there going, I have no clue what to say right now. Please give me a sign. A lot. Happens a lot.
Now, if you notice, sometimes we'll get clients that come in that look completely detached, flat affect, can't read them. Detached. And sometimes we have to use all of these survival skills all at the same time. And let's just say hypothetically we have a client that's completely detached, we can't read them, we can't figure them out. It's the same look that 99% of our military comes in with. And it was the look I had for a long time when I had death notification detail. And that was, I had to go with the lieutenant to let families know your loved one just died. Completely detached. No affect, just stand there, completely still. This is what happened. Your loved one has died. Sign these papers. And they will be breaking down all around us, crying, hanging on to us, no, no, no. And we can't move, can't feel, can't change our affect. And to do that on a daily basis or as often as we had to, and then we have to do it early in the morning, right? So that way they have time throughout the day to go process with whoever. And then imagine doing that and then, all right, what are we gonna do for lunch? We become so numb and so detached to that type of stuff that sometimes we can't get it back. To reintegrate with our emotions gets really difficult after a while. And as a civilian, sometimes people will say, yeah, you're really cold-hearted. Doesn't that make you sad? Yeah, I mean, it does, but I'm sad. It's like here, it just won't come out. And I try, and I think sad thoughts, but it won't come out because it has become a part of who I am.
The other thing, too, is when he was saying thank you and smiling, it wasn't just because, okay, I'm out of here. Right. He truly was. Well, why didn't he do that before? Because he's an officer in the military, and officers are going to be much more non-affect, stiff, stern. He has to maintain control at all times. Especially, and here's the thing we run into, when you have officers and then you have subordinates. They come in here and it kind of does them a disservice because I'm an officer. I got to act like an officer in here. I can't let my hair down. I can't show them that I'm weak. So that's another issue we run into. But really the only emotion they can show, that they will always show, is anger. Mm-hmm. Anger is an empowering emotion. Releases adrenaline. Makes them feel in control. That's why we see that irritability all the time. All right. There's one called the 20-minute fix. I got 20 minutes or an hour. I got a short amount of time, basically, to handle a problem and get on to the next one. I got so much time to handle this mission, and then we're going to be assigned a new mission. Now, the job works great. Our personal problems don't take 20 minutes to fix. And so a lot of times they will come in here and it's, that Joe Fry, just tell me what I got to do. Just give me the facts. Just give me the time. Just tell me what I got to do and let me do it. Or when they're home with their families. I still do this with my wife. Honey, I don't need to know this other stuff. Just tell me what's going on right now. Oh, that goes over well. We went over the black and white thinking, the denial, the detachment. They deny that their problem is that big because that helps them detach from the guilt and the shame that they're feeling because of it. So they'll fight you on that they have a problem. Everyone is a threat. What does a threat look like? What does a bad guy look like?
So a lot of military people, not all, but a lot, come in here not trusting anyone. And I get it, you have great intentions, you dress well, you have a wonderful smile, but I don't trust you. I don't trust you. I don't trust what you're saying. I need you to prove it. I don't trust anybody. I don't trust this facility. I don't trust the process. I need it proven. Because right now, y'all are the enemy. And that's just the thought process behind that. And that's going to stick with them for a long, long, long time. Years afterwards. It becomes ingrained. All of these trainings and all these survival skills become so ingrained, it becomes who we are. All these years later, I still struggle trusting people. It's the same thing. When we first meet, I don't trust you until I get to know you. It's a part of the thought process that's just been ingrained in there. Now here's the kicker. For a lot of them, it's not just ingrained in the military training or in the paramilitary training. It's been ingrained since childhood. Because something happened in childhood. Or the family was in the military. Or the family was dysfunctional. So I can't trust. Every time I trust, I get hurt. So then I join the military or paramilitary and it becomes validated. So then, yeah, that's right. I shouldn't trust anybody. Everybody's horrible. Everyone's out to get me. So that's what we see from a lot of them. I don't trust you. That's why for a lot of them it takes a while to build that rapport. They're not just going to come in openly and be like, hey, here's all my secrets. It's not going to happen.
And one thing you can do is, we have Casey now that's here quite a bit, and we have Jerry. And use them when you have a responder if you need help. They're very good at it. Or if there's issues. Sometimes, like if you have an issue with a responder, especially military, grab another military personnel that you may know is an officer or is maybe senior here and say, hey, I need help with this. Can you go straighten this person out? And they will. They will. And if you ever notice, you might go, okay, well, we had a problem in a group, but why didn't they say anything then? They don't do it in a group. It's later. They'll grab them and pull them aside and say, hey, knock it off. And when they settle things, it is not pretty. Okay? The naughty words fly. They fly, and it can sound very, very, hey, they're going to fight. No, they're not. They're hashing it out. When responders get together to hash something out, it is never pretty.
If we show any sign of intimidation or I don't know,
Yes.
they don't respond well to that. Because then they don't feel safe. Because if you don't know what you're doing, or if you can't hold your own, they don't feel safe. Then you can't take care of me.
And if you ever are stern with them, okay, and they get upset over it, they're still testing you. And how you handle that is simply this. Hey, so what you're saying is I got in your face a little bit and for what I said, and that upset you. And they're going to say yes. And then you just say, you know why I did it? Because I knew you could handle it. You're a Marine. Come on, you're a Marine. That's why I did it. You will gain respect. If you have in the community, I'll say civilian, or civilians that are trying to address a problem with a responder, okay? Now, let them say what they're going to say. When the responder is going to respond back, you can let them say a little bit, but if you need to just shut it down. Say, okay, you know what, we'll talk about this. You pull the responder into your office, okay? Because they're not going to listen to what the civilian has to say, but they'll listen to what you have to say, and you just deliver to them, hey, look, so-and-so, well, yeah, but they're this, and they're weak, and oh, okay, so everybody in the room's weak? Is that what you're telling me? Come on. No, I sat there, I listened, and guess what? I do see that in you. They're going to listen to you, and that's how they'll take it in. Responders talk at people. They don't talk to people. They think they talk to people. No, they talk at people. So you'll feel that at times from them, especially when they want something. Okay? They're going to be, and don't take offense to it. It's not them being angry. And I still do this stuff. It's funny. My wife knows because she'll go, oh, okay, Sarge, you got it. Oops. I say, no, honey. It's Dr. Langus or sir. You're not going to tell her I said that. I mean, I don't care if you do. No, I mean, but you're really not, right? I mean, really, you're not going to say anything, right? The reason I point that out to you guys is that's the way responders are built, to help and to save. So sometimes they can come off and look mean and aggressive and all this stuff. It's their heart. They're not here to fight. They're not here to harm. In fact, if anybody tried to do anything in here, they would be all over them in a heartbeat. So a lot of times, I've heard before with people, I worry they're going to hurt somebody. No, they're not. That's not how they're built. They're built to save, not to harm.
Think about some of our clients that have come through here, some of our military, some of our first responders. Those that are the angriest are the most hurt. We had one here not too long ago who was super angry and super aggressive. Well, he lost his family member on the field and wasn't able to save him. Right in front of him. Wasn't able to save him. close family member. So that hurt went so deep, it was hard to comprehend how deep that hurt was. That's why that anger was as big as it was. That's why the aggression was as big as it was. They're not taught how to experience hurt and emotional pain and sadness. It's not a thing, because if you experience it, you're going to die. Out in that field, he wasn't allowed to experience it. He had to immediately detach, leave the body, and move forward with the mission. You can't feel, or you're going to die. And that's what's instilled in there. And I mentioned earlier, very briefly, we were assigned a battle buddy. My battle buddy died. I couldn't save her. There's nothing I could do. I had to leave. And for some reason, that just triggered that. That was weird. But all these years later, it's still there. What could I have done? Even though rationally, there's nothing I could have done. But we take that super seriously. So all these years later, I'm still going into situations going, what can I do to make sure you're safe? And if I can't, shame on me. If I can't, then I suck. I shouldn't be here. And so it's such a very fine line. It's not that he's not trying to be an ass. No one's trying to be mean and aggressive and start stuff. It's just, I don't know how to process that. I don't know how to accept the fact that I was responsible for you, you're responsible for me, you died. So where did I go wrong? What did I do wrong? Because I should have saved her. That's the thought process. As a civilian, they're like, no, you did everything you could. There's nothing you could do. That's not a thing. Because we are taught that it is so ingrained, there's the shame, there's the guilt that will stay with us, sometimes forever. Even in those moments when we think it's healed and processed. Because for some reason I thought that was healed until that triggered that. That's what I'm talking about. That's what we're seeing in a lot of them.
When you see the irritability or anger come out, that's the gauge that's telling you the amount of hurt, helplessness, or fear, to what level they're feeling one of those three things. That's where the anger and irritability, because it makes them feel powerful. And usually after we trigger their traumas, because you guys are left to deal with it, right? What we will do is I will put in my progress note what happened and what you can expect to see. Expect to see irritability and self-defeating behaviors, which may come out as far as treatment sabotage. So that way you guys know, okay, they're acting this way. No, that's the trauma. And I'll go to nursing and I'll tell nursing the same thing and say, tell night shift what I'm telling you about this person, so everybody's on the same sheet of music. The kid, when they interviewed him, did you see him? He was talking, he lost it. Then you saw him come right back up. Did you see his eyes? You saw anger there. That's how he brought himself back into control. Anger. And if you notice, he said in there, somebody gets in the way of me trying to save one of my own. It's a bad day for them. And then what also goes to, remember we talked about how big it's ingrained in them of being this responder. He said in there when he first started the interview was, me saving them supersedes any right. And that's how they look at life. So they have a hard time letting go and having fun. They have a hard time talking in a group. I've got to keep this exterior. That supersedes any right. We're trying to teach them to be able to decipher who needs to be out right now.
Yeah.
Does the soldier need to be out? Does a police officer, does a firefighter? Or does the dad need to be out? Or the husband? Or whatever? Yes, and that's what, and here that we can do that. We say, okay, right now we don't need the soldier. We don't need this. Now, in a group setting, don't take that away from them. I mean, if they don't want to share in group, they'll share one-on-one. They won't share in group. And I know it may feel counterproductive. It may feel like, okay, well, other patients are saying, why does this person not have to share, but I have to share? And well, this one is different. These are some of the common issues that we find with staff. One is the countertransference. Okay, not the transference, the countertransference. So, and now, but that also can be used to help them too. But what we're talking about is if somebody is, you have a counselor that may has gone through abuse, and then you have a responder that's a male, and he might be big, and he's acting irritable or something like that. That might trigger that abuse and the countertransference. So not only in yourself, we have to watch one another too to know if, hey, somebody else it's countertransference coming out for them. Because believe it or not, as clinicians, we can sabotage treatment for them real easy if it's our countertransference coming out. But again, it can use for positive too. I share my experiences with everybody. I tell them what I've gone through, and it helps for them to be able to, number one, connect, the trust, that you're human, and that you get it. And you don't have to have been over in a sandbox in Iraq to be able to identify with them. Okay, you've gone through your own traumas in your life, share them. You know, I've heard you, Kaylin, talk to people at times and talk about what you've gone through. And, you know, they listen, they and you identify with them and you hook them. It's good to do. So your own disclosure, which I was just talking about. Concrete thinking. Don't get too set in your ways. You know, especially with addiction in general. We got to adjust on the fly, and staff expectations. Where do you meet the patient? Do you meet them where they're at? Or do you meet them where you think they're at? Or do you meet them where you're at? And a lot of times, you know, we're meeting them where we're at sometimes, our expectations. So we got to check that to see where am I at with this client. Is it where I want it to be or where they're at? And one of the biggest things, if you're having issues, and they might be part of that issue, okay, they're demanding their meds be changed or whatever it is, okay, they're used to task orientation. So what you do is get them involved in it. Hey, I need your help with this. Help me solve this problem. And of course, yeah, they're going to try to manipulate and bully to see if they can get it. Well, I want you to do this. You do it. Whoa. I can't. So we got to think of something else. Help me think of something else that's going to work here. And give the assignment to them. They're task-oriented. If you get them involved in it, it'll go much smoother, much better, and get more done.
And let me touch on this real quickly. The rigidity, they need that because it equals safety. The black and white is safe. If you want me to get into the gray, I don't trust that, I'm not going there. And because that causes fear, now you're going to see my agitation. I need to know it's either yes or no. It's either 9 o'clock or 11 o'clock. It's either this or it's that. And if it's not, explain to me why. That's all. Because if you explain it to me in a way that I can understand, then okay, I get it. But if it's just like, look, that's just the time, okay? I gotta go, I have other things to do. Now, I'm gonna take that personal, and I'm gonna take it like I'm not safe here again. Remember, they're all about safety because they're either gonna kill or be killed. It's so ingrained. So the rigidity, black and white equals safety. I do this happens, and let's move forward. So it's difficult for them to get in the gray. And if we keep that in mind, it'll make it a little bit easier. And then it's all about communicating. If it's no longer 11 o'clock and now it's 9, now I gotta explain to them why. Because they'll hear it. They still might be a little bit agitated, but they'll hear it and they'll be all right.
And like you're talking about, I got to go ask Bill, okay? When they react to that, instead of saying, I got to go ask Bill, just say, I got to go ask the commander.
Okay.
And they're going to, oh, you don't know? Hey, man, I'm just like you. They're rank structure. And they're going to go, as soon as you hear that, you won't hear another word out of them. Oh, yeah, I get it. That'll be it. All right. This is the thinking paradigm and problem-solving paradigm they'll come in here with. They come in here with the job-solving paradigm, okay? And that is define a problem, find the solution, implement solution, period. End of story. No gray, black and white. Where do they get that? Just like us, training, schools we go to, on-the-job training, advanced training. It's where they learn it. And if you think about, for all of us, it's the same way. Where do they learn personal life problem solving? Just like all of us. There's no, handling life 101 in the JCs. And so define a problem. And then they get tunnel visioned on it, and that's where they stay. It's where they stay. And then they start going back into all those behaviors again. I solve it in 20 minutes, or win or lose, win or lose. I had a buddy of mine call me at I don't know, midnight, 11 o'clock. Todd, it's over. It's all over. It's over. It's over. Tell me, what's going on? What's going on, bud? The marriage, it's done, Todd. It's done. Okay, and we started talking, and he was just so ramped up that, okay, I'm on my way over. So I drive to his house and get there and get in there talking, and he's ranting, it's over, Todd, there's nothing we're going to do, it's a divorce. And I go, okay. And he's tunnel visioned on this. And he's in that possibility, okay? And he's in the win or lose. It's either a divorce or we're back together, no in between. And right now they're in between, and he can't handle it. And so I said, okay, wait a minute. Did she serve you with divorce papers? No. Did she tell you she wants a divorce? No. Well, when I walked up, your shit wasn't on the lawn like a yard sale, so she didn't throw your shit out. No. Okay. So, you know what? Let's wake her up and find out what's going on. Now, if she didn't want to divorce him before, me coming into her room at 3 o'clock in the morning now to wake her up, she's going to want to divorce him now. So I get her up, and I said, hey, Carrie, what's going on? Todd, we've been having problems. I know. I said, look, are you guys getting divorced or what? She goes, where are you getting this? And I go, And she says, no. We got into an argument. I told him, if we don't go get help and do some work on our marriage, it is done. And if you're not going to do this, then yes, I do want a divorce. And so tonight, I want you to go sleep in another room. I don't want to sleep next to you. But he went right into that black and white thinking, win or lose mentality, possibility, prepare for the worst. And he went right to divorce. He got tunnel vision on it. And when they get tunnel vision, they cannot pull themselves out. And this is a lot of times for them where they go into suicidal ideology.
Yeah.
And this might be a little confusing because this is the time now we want them back in job mode. Wait a minute, Todd, you said get them out of job mode. Yes, but this is the time when they're getting caught up in stuff, we want them back into it. Hey, soldier, all right, this is what I do with them. Feel free to use my stuff. I will tell them, all right, let's change this. You're in the field, you're on a mission. You're being shot at. What do you need to do right now? Well, where's the rounds coming from? Okay, good. What next? What next? What next? They'll go right to it. Okay, now, take that same thing. What do we need to do with this problem? What do we need to do first? They'll go to it. What do you need to do second? What do you need to do third? Okay, good. We just solved the problem. If you notice that they're in the possibility and probability, if they're in possibility or preparing for the worst, reality testing works very well with that. Okay? Wait. So
And DBT is perfect for them.
bring them right out of it. Okay, this is ways to help them overcome. One is, the first thing you got to do, you got to identify what trait or behavior they're in. And they might be in 3 or 4 at the same time. Okay? The second thing is, help them identify the behavior. You're going to have to tell them, hey, are you thinking in cop mode right now? Are you in soldier mode? Are you in firefighter mode right now? Now, at first they may say no. Well, wait a minute, let's talk about this for a second. Out on the street, how would you handle something? Well, do this, this, and this. Is that what you're doing now? Yeah, I guess I am. Okay. So you're trying to do a 20-minute fix here, bud. You're trying to solve your problem in 20 minutes. We got 30 days to do this. Help them to identify that that behavior works great on the job, but how is it not working good in your life? Right. And I do. And this is where I share my own stuff with them. Demonstrate what different behavior will work in the situation. Give them an alternative. Now, usually with therapy, you know, it's, well, doc, am I crazy? Or doc, this? Well, what do you think? Or how do you feel? That doesn't work with them. You got to be direct. If they ask you, answer. If you are indirect with them, you are playing games, you are not taking it seriously, and you've lost them. Dr. Todd, am I screwed up? Yeah, boy, you don't know how much. But we can fix it. We'll fix it.
There's a solution.
Right.
Here's the problem.
And they don't get worked out. Okay, yeah, okay, good. Not, well, do you think you're screwed up? No, I tell them, yeah. Use job examples to help them overcome. They'll always say stuff like, I had a firefighter that wanted to leave treatment, and he's like, oh, I got to get out. Well, why? Well, because I fix my problems on my own. Now I take them back into job mode. Right. Oh, really? So what do you do as a firefighter? I'm an engineer. Oh, you're the guy that drives a fire engine. Yeah. Okay, so riddle me this. When the tones go off at 3 in the morning for a structure fire, you alone jump on the fire engine, never say fire truck, or they get all worked up. It's not a truck, it's an engine. That's where you got to learn your trucks and engines and all that kind of stuff.
Trucks and engines.
The trucks are the ladder trucks. They carry no water. Those are trucks. The engines are the ones that we mostly see around that doesn't have the big ladder on it. So you're the one that jumps on the fire engine alone. You go out there, you charge the engine up, you grab a line off the engine, not the hose, the line, and you rush into the fire and you fight it all by yourself. Well, no. What do you mean no? Well, I got other guys. Who do you got? Well, we got the firefighter, I got the captain there. Tell me a little bit of what they do. And they'll tell me. I said, okay, so what you're telling me is you got backup. Yes. What do you think we are? We're your backup. And you're not using it. You're fighting the fire on your own right now, you idiot. And you can talk to them like this. They get it. That's what they understand.
Well, don't just walk around calling them idiots. Yeah, I'm like, I wouldn't do that. Yeah.
No, but I mean, in these situations, they'll get it. And you'll see them smile or laugh.
Let me jump on this first one real quick. Use of a plan in their responder survival causal factors. I just recently gave a client an assignment. I loved it. It was great. Here's the topic. Write about it. Okay, what exactly do you want me to write? About the topic. But from what point of view? Just whatever. Just write about the topic. Well, how many words does it have to be? Just whatever. And he got red immediately. His anxiety shot up. You could physically see it. His breathing pattern increased. He started fidgeting. Started sweating. And so what's happening? Sweating. I say sweating. My bad. Sweating. Edit that. And I asked him what's happening right now. Like, you're super flushed. What's going on? Well, you're not giving me any direction. I see, I did. Here's the topic, write about it. But you're not giving me any specific direction. And I need to know what you want me to write about. How do you want it structured? How many words does it have to be? I'm not going to tell you that. Figure it out. It took him from the time he got here to the day before he discharged to do it. Because there was no direction. It was way too gray. And they don't operate in the gray. They need a plan. In his head, he said, I need to make an outline first before I can write. This is how I do my assignments. And you're not letting me create an outline. There was no plan. This assignment, and I never give directions with my assignments. That led into my ability to help him see that in him. Not to strip it away, but just to recognize it so he can see, this is why my kids don't talk to me. This is why my spouse doesn't talk to me. But this is why I'm doing well at work. So just to help him point it out and just so he could see it and be able to identify it, that's what helps them. Does that make sense?
Yes.
And then, of course, we all know the second one. It's a thing. It's a subconscious thing. They don't understand the whole, you're in phase 2 and he's in phase 3. They just know that's my brother, that's my sister in arms, and we need to be together. Even if we don't get along with her or him. But we still need to be together. We still have to have each other's back. So I don't understand why we're not all together and they gotta stay over there and I gotta come over here. And then what they're gonna do is pull him aside and be like, look, you need to talk to your case manager, see if you can come over here. Do you want me to go with you? Because we'll all go with you. They'll bring the whole heroes group to you as the case manager to advocate so they can come over. It's just how they're trained. Because if one gets left behind, then we failed. It goes back to my battle buddy that died, I failed. If we leave one in detox and we're all over here at Sage, we failed. So they're gonna put up a fight. And it's not to be disrespectful or rude. They gotta understand the concept first. Then they'll get it. Because that happened many times over the past few weeks. Because it's a thing. Effective communication.
To stay alive, you have to have
Big one.
good communication. You've got to be able to communicate with one another to stay alive, to stay safe. Proper tactics, their tactics keep them alive, keep them safe. Same thing with equipment proficiency. They know how to use every piece of their equipment and they know how to use it well. Effective decision making, again, to stay alive, mental attitude. That's why no breaking down, no showing emotion. In order to stay safe, stay alive, get through this task we have to get through, and follow through. Those are a responder's survival causal factors. What does that have to do with treatment? Because that goes into what they expect from staff. This is the things they are looking for. Do you have a plan in place for them? If so, what is it? Communicate it with me. Communication with the responder and explain your actions. Well, I don't have to explain my action. I'm a counselor here and I shouldn't have to explain I'm a nurse. I don't have to explain my actions. Yeah, you do. You do. It's going to help comfort them. Follow through. If you say you're going to do something, do it. Do it. Any one of these things get left out, you've lost them. You've lost them. Good decision making. Be direct with them. We went over that. Be consistent. That's why when things change, they have a hard time with it. Or they ask one person, well, it's 8 o'clock. The other person, it's 9 o'clock. And any one of these things get negative, they take it as a death.
That's from intake on. I noticed that from intake.
Uh-huh.
You want to plan, they do very detailed, and it's like,
Uh-huh.
oh yeah.
Absolutely. Do you know your position? And the biggest one is staff working together. They watch us like a hawk. They know who doesn't get along with who. And you can be in nursing with the doors closed. Oh, they know. They watch through a window. And body language. They don't have to know what you're saying. Body language. Mouth. They don't have to, they're not reading lips. But they're watching how fast, and you can tell is that person may be worked up or angry or whatever.
Here's what they're doing over there on the detox side. And I don't know if y'all ever noticed this, but over there where they sit waiting for the doctors, they're going to have the higher ranking guy sitting down and the lower ranking guy standing up, watching the nursing station, watching the west room, and watching the doctor's office. And that lower ranking guy is gonna report any discrepancies that's happening to the higher ranking guy, and that higher ranking guy is gonna let everyone else know in the heroes.
Right,
It's subconscious.
And we have to explain to them sometimes, hey, wait a minute, what you're getting worked up over is not life or death, man. You're not in the field. This is not life or death. I know what you think is important, and I always say, in the scheme of life, how important is it? Not right now, I said in the scheme of life. Sometimes I'll look at them and go, hey, you being shot at right now? What are you being shot at? Is your life in imminent danger right now that you don't have your meds? Well, no. I go, then you're acting like you're being shot at. You need to relax. We're not going to be perfect with this, okay? But we try to do the best we can because these are the things that they're looking at. In the interest of time, we won't have you guys get your boards, but what are some of the staff's mindsets or beliefs about the addiction population? I put an example up there like all addicts lie. Okay, they're beautiful, broken people.
And I love them. And they're all cute.
What else? What's that? Okay, this is some of the unconscious mindsets that they have that interferes with treatment and staff. A lot of these we've already talked about, so I'm just going to hit a couple. Their unconscious mindset when they come in here as a responder is, I'm a problem solver, not a problem haver. So they're going to come in here in that denial that they even have a problem, or their problems are as big as what they are because then I'm not a problem solver. So we have to point out to them that, you know, no, in your work life, man, you're real good. And I always tell them, I go, hey, I sit in my office, I'm a great therapist. I help people all day long. When it comes to my personal problems, it's like being my own attorney. No, you can't do it. So, again, ask my wife, she'll tell you. Cannot show weakness. Okay, habituation. Responders are so used to dealing with negative, negative, negative. I never got a call that said, go to this address because they've got spaghetti and meatballs for you and they want to tell you what a bitchin' job you're doing. It's not how. The calls are never positive. So when they're dealing with negativity day in, day out, the military, especially if they're deployed, 24/7 in a sandbox, a shithole, they start getting habituated to negative. So much so that positive feels uncomfortable for them. So that's what happens a lot of time. They're starting to feel better, and then we see them like, well, wait a minute, why is it they're not getting, you know, that we hit a sticking point, they've regressed, whatever it is. Yeah, they're starting to feel good. And that's uncomfortable to them because they're so habituated to the negativity. And they don't know they're doing this. And when they do, that's where the treatment sabotage will come in a lot of times. Or their negative actions here on the units. They're used to it. They're not used to peace.
Here's one area of progress that I was able to see in the group. Processing chaos or maladaptive behaviors. And one client in particular was able to identify, I'm not used to sitting in quiet, serene peace. I am used to chaos because the military is chaotic. There's things happening all the time, all at once, and there's no peace. There's no sleep. You're not resting when you're sleeping. We're woken up at 2 a.m., 3 a.m. We got to be on our step, so there's no peace. So when it's peaceful and everything's cool, I don't know what to do with that. So I'm going to get involved or start some stuff. That also goes back to childhood. That also goes back to the environment I was raised in. It was chaotic. This is what I know. This is what I'm used to. I don't know what it's like to just sit. I don't know what it's like when everyone around me is positive and validating. So when they're able to see that and recognize it, then you see the remorse happen, then you see the processing happen, then you see some of the vulnerability start. Some, not all. But it's helping them identify that so they can recognize it and then empower them to make decisions based on now you've got this newfound knowledge. Now you're able to identify it. What are you going to do with it?
If they feel good about something, I tell them, what you feel good about right now, I want you to think about it an hour from now. I want you to think about it at dinner. I want you to think about it before you go to bed. I want you to think about it when you wake up in the morning. And I want you to feel those same feelings. And it might be something where they said, they might go, yeah, last night I talked to my kids, and how was that? But I go there with them, and I make them think about that phone call. How was it hearing their voice? Do you miss them? Oh my God, yeah, I miss them. What do you miss about them? And you bring out the things that are bringing out joy to them. And how do you feel about this? Oh, it feels so good. Okay, I want you to keep holding on to this feeling. I want you to go back and think about this call throughout the day, tonight, before you go to bed, when you wake up in the morning. And that's going to get them connected with that feeling good. The two lethal emotions is fear and helplessness, and it's because how we internalize emotions. Guilt is internalized, we know, as, okay, I've done wrong. Did something bad. Shame is, I've done something wrong because this is who I am. The fear and the helplessness, though, are worse for them. The fear they internalize is weakness. If I feel fear, it means I'm weak. To help them get over that, you've got to help them understand what fear is. Fear is an emotion that was given to us as a life-saving emotion. If I feel fear, it means there's red flags in my environment that tell me danger, that if I don't do something about, something bad's going to happen. That's all fear is. Believe it or not, once they get to know that, they're fine. They're over it. And I'll say, where did you feel fear in this incident when you were attacked? And they'll tell me, and I'll say, now, did that help in any way? Oh, yeah, man, the fight or flight kicked in. I started fighting. Yeah, if you didn't pay attention to that fear, what would have happened? Oh, man, I probably would have died. So fear's good, right? Yeah, I guess it is. So just by teaching them that, they're over it. It's not weakness, strength.
And when it comes to the fear, because again, fear is huge with them. So I take them through a 4-step process. You identify it, you acknowledge it, you process it, and then you make a decision on what you're going to do. Because fear is just your body's way of telling you to do something, or something needs attention. So once it's broken down and something step by step and rational that they can grasp, then they're going to work through that. Because their automatic emotion is, I'm angry, I'm irritated, I'm pissed, and then I'll ask them, what are you afraid of? Then we'll go through those 4 steps. So if we can make this very CBT, DBT-ish and something that that's tangible, they're going to respond to it. And it's in the individuals where we get all mushy and look at all that other stuff. But when they're out in the community and in the groups and stuff, tangible stuff they could do. The tangible things, once they can process it in their head step by step, then it'll start making sense to them.
Helplessness, they internalize different. Helplessness is internalized as they've lost or they're losing control. Therefore, they're failing or they failed. Helplessness equates to failure. Now, when we fail, when we screw up, what do we expect to have happen? Consequences. Punishment. Who's our best punishers? So for them, when they feel helplessness, they felt that they've lost control, therefore they failed, and the punishment sets in. And the way they punish themselves is they deny the things they love the most. I'll sabotage my career. I'll sabotage my life. I'll sabotage my family. I don't deserve them. In my career, I was involved in some shootings and stuff, but one of my partners was shot and killed. I was the first one there, and I basically sat in the street cradling him as he bled to death all over me. I was sticking my fingers in bullet holes trying to stop bleeding. Yeah, I know that's not how we stop bleeding, but in irrational times, you do irrational things. I couldn't save him. I failed. I was a failure. Everybody goes home on my shift, and he didn't go home that night. So I needed to be punished. No punishment was coming. Everybody was saying you did a great job and all this stuff. No. So I started screwing up at work. I started starting arguments at home. Now, I didn't do this consciously. This was all unconscious. We have to help them understand that. So if they're dealing with trauma, and I don't care who it is, where was the point where they felt helpless? Because that's where it is. That's where it all lies. That's where they felt they've screwed up, didn't do enough, whatever it is. And you have to explain this to them, that this is how you're processing it. And they'll tell you, do you feel like you screwed up? Oh, yes. Now, you may say, are you punishing yourself? You'll be surprised. Someone will say, yeah. Someone will say, no. Yeah. And then you go, well, what's this? What got you here? And for them, that's why for responders, it's a double whammy, or anybody with trauma, because on one regard, the substance screws up my life, so it win there for punishing myself, and it helps me numb out. Oh, we got a win-win. We're trying to break here. That's why with responders and people with trauma, it's so hard to break, because it's a win-win there. And that's why they hold on to it so tightly. Now, one thing that a lot of times we'll hear is, and you guys will see this and even say, look, they're not focusing on their program, they're focusing on helping other people. Leave it alone. Leave it alone. As long as they're doing their program too, leave it alone. Why? Remember, they're responders. They feel they have to help. So if we start taking that away, no, don't focus on helping that person, do your own. Oh, you're going to get a lot of anger, irritability. They're going to help out others. Let them help out others. Just make sure, we have to make sure they're working their program.
One of the biggest things with that too is they gotta feel empowered. Remember, a lot of them are going back into the field. We can't take that power away from them. They have to feel empowered. So if we can find a way to allow them to feel empowered in a productive way, give them a role. Let them be the president. Let them be the local Leo. Let them take a role. Have them be the greeter to the other responders. Whatever it is, or if they're just being of service to others on the unit. They gotta feel empowered instead of us stripping that power away from them. So they're not necessarily in this area, they're not sabotaging their treatment. It's just what they know. If you're struggling, then I'm gonna help you. I'll still get my assignments done, but I'm gonna help you. Because that's what I do. It's what I know.
Charlie Brown is how responders think. We've got to try to show them the Snoopy mentality.
I love that. That's cute.
There's a couple misunderstood areas in treatment, and a lot of other treatment facilities are doing certain things that are making trauma and really making matters worse for the responders. And one is hypervigilance versus tactics, and knowing the difference between the two. You want to have fun with me? Take me out to dinner and put my back to the door. I'm uncomfortable. I don't like it. We're not going to have a good time. My wife knows and my friends know. We go out to lunch. Todd sits where he can see the door. Why? That's where the threat's going to come from. If I can see where the threat's going to come from. Now, that's not hypervigilance. That's not paranoia. Those are tactics. I was trained that. Some treatment places will try to take that out of them, and they're making matters worse. We had a patient we got here that they made sit in a room with his back to the door for hours. Immersion therapy. For what? They were telling him, because you're hypervigilant. No, that's tactics. You can have them sit there till the cows come home, and you're not taking it out. And that's why the patient left there and came here. So there's some things that are hypervigilance. There's another patient where she was overseas, did a bunch of tours, and at night, okay, to sleep, they hear. That's why you heard Christina saying that you're really not sleeping. Your eyes may be closed, but you're always active. So they may close their eyes, but then they're hearing. Well, so she is uncomfortable with her eyes closed, and she was a very light sleeper. So on the unit, she'd wake up at all hours, and they're like, hey, look, you got it. And she goes, I'm just a very light sleeper because of where I was. So they forced her to put earplugs in. And now she starts reacting because you're taking away the one sense she had to keep her alive, her hearing at night. You're not going to take that away from them. And we shouldn't even try.
This is also true in some of the groups that we have. We had one client a while ago, and in one of the interventions in group was to blindfold them. Now they're super compliant, they were gonna do it. But she was a hot mess inside. She was totally triggered, total panic attack, but she's not gonna show it. She's gonna go through with the intervention, and she's gonna go through the group, and then after group, come straight to my office and was in full-blown panic attack because of the activity. Because she was blindfolded. Not only did it trigger that, you just took away one of my senses that keeps me alive, but you also just triggered my sexual trauma. So we gotta be super mindful of kind of all of those, because they're so multifaceted. It's not just drugs and alcohol. They're so multifaceted. We've gotta stay mindful of that.
So like I'll even notice, like I've noticed it right away, like they'll try to, like if we're in, on the weekends we're in here, like they'll walk in there because they want to see where those cameras are.
Yeah.
You know?
Yeah.
Like, and you see them do it, and so like I've just kind of come to the place where I accept that they know where like all of the cameras are, you know?
And that's actually one of their tactics.
Right,
They
right,
want to walk around, they want to know where all the exits are, not to escape, but they need to know the lay of the land to feel safe.
Right.
That's all that is. I mean, heck, if they could walk to the SNF unit, they would.
But then it's like, but then you have that addict part,
Right.
and then now we have this problem
Right.
where they're jumping fences.
And I think that's where we, as clinicians, have to shift our mindset to see what's the addict behavior and what's this training, or what's their training. Who are they? What is their...
Well, and some of it's they've been trained in like hyper great addict behavior. You
Yeah.
know?
Yeah. And because it's so intermingled.
Right, exactly.
So that it's being able to discern between the two.
And part of the biggest thing is one of the best things we can do is when they get here, we do a walkthrough with them. And a lot of times, we're not going to show them Sage because they're on detox. No, walk them through Sage and everywhere so they get the lay of the land. They will feel so much more comfortable just because they know where it is, and they know if they hear this door opening, well, what is that? And then they know, it's just going to the other side. Everything's good. You've been over there. And they will feel a lot more comfortable with it. Well, you guys know this one. It's the most widely... But remember, it's not only encouraged in responders. It's expected. You are expected to drink if you are in one of these jobs.
You will get hazed if you
You're right.
do not.
Here's some readings. I highly recommend The Emotional Survival for Law Enforcement. Now, it was written for law enforcement, but it covers military, it covers firefighters. It's all-encompassing. It explains a lot of things. And then the other two, Force Under Pressure, is also very good. They're quick reads, easy reads, and it really gives you the in-depth of what responders are thinking and how they're reacting.